Hello and welcome. You are watching Gravitas Plus. I am Molly Gambhir. In India, following the reactions to the Supreme Court order on shifting stray dogs in Delhi NCR to shelter homes in view of the rising dog bites and rabies cases, the Chief Justice of India had constituted a three-judge bench. This was in response to protests against the order that was passed. And on Thursday this week, the three-judge bench of the Supreme Court reserved its order after a hearing. The three-judge bench blamed the inaction and inefficiency of the local authorities in implementing animal birth control rules for the proliferation of stray dogs on the streets of Delhi NCR. Earlier in the week, reacting to the Supreme Court's order earlier to pick up stray dogs and keep them in shelter homes, people troubled by the increasing number of dog bite cases termed it as a relief. There were also some angry reactions from people saying it is not right to remove stray dogs at once, including views like if the stray dogs are vaccinated properly, there will be no need to remove them, and that the government should focus on animal birth control so that their numbers do not increase. Some of the views. Some animal lovers demanded the withdrawal of the Supreme Court order on shifting all stray dogs in Delhi NCR to shelter homes in view of the rising dog bites and rabies cases. And then on Thursday, the three-judge bench of the Supreme Court reserved its order after a hearing. Just a quick backgrounder here and for some perspective. As per Articles 243W, municipalities are mandated to control the stray dog population, implementing the Animal Birth Control Program to regulate the population of stray dogs. In fact, to support effective dog population management, the central government notified the Animal Birth Control Rules 2023, superseding the earlier ABC Dog Rules 2001. Basically, the rules focus on the neutering and anti-rabies vaccination of stray dogs as means of population stabilization. Just for some more perspective here, what do the numbers tell us? The data on the total number of reported dog bite cases and suspected human rabies deaths is collected from the states, union territories under the National Rabies Control Program by the National Center for Disease Control. Look at the figures, for example, for the year 2024, showing the total dog bite cases and the total suspected human rabies deaths. For those unaware, rabies is a viral disease affecting the central nervous system. Once clinical symptoms appear, rabies is virtually 100% fatal. The incubation period for rabies is typically 2 to 3 months, but may vary from 1 week to 1 year. Simply put, this is governed by factors like the location of the virus entry and the viral load. Symptoms include fever, pain, unexplained tingling, or a burning sensation at the site of the wound. Those are the initial symptoms. And then as things progress, the virus makes its way to the central nervous system. It leads to inflammation of the brain and spinal cord. And rabies has two forms: furious rabies and paralytic rabies. Just for some more context, clinical rabies in people can be managed but very rarely cured, and not without severe neurological deficits. Looking at the broader framework, across the country, several initiatives have been taken. Some of the initiatives that have been taken in the country by ministries, departments concerned with the aim of prevention and control of rabies. Just for some broader context, for example, at the central level, under the National Health Mission implemented by the Ministry of Health and Family Welfare, states are being supported by providing budget for implementing the National Rabies Control Program through budget for capacity building of the healthcare staff, procurement of rabies vaccines, monitoring and surveillance, establishment of model anti-rabies clinics and wound washing facilities, etc. Under the National Rabies Control Program, several initiatives have been undertaken. These include launch of the National Action Plan for Dog-Mediated Rabies Elimination, budgetary support to states, union territories under National Rabies Control Program, ensuring availability of anti-rabies vaccine and anti-rabies serum at health facilities, conducting workshops to formulate state action plans for rabies elimination, strengthening rabies diagnostic laboratories, issuance of advisories and communication to states, constitution of national and state level committees under NRCP, conduct of training programs, community awareness campaigns on dog bites and rabies, establishment of a rabies helpline, strengthening of rabies surveillance mechanisms, and so on and so forth. In fact, just another example here, earlier this month itself, the center said it has significantly increased financial assistance for the sterilization and immunization of stray dogs and cats under a revised animal birth control scheme, with funding now reaching up to Rs 800 per dog and Rs 600 per cat for participating organizations. The enhanced scheme, implemented through the Animal Welfare Board of India from the current financial year, marks a substantial increase from the earlier provision of Rs 445 per dog under the previous framework. And these are just some of the examples, some of the initiatives. A key aspect at play is dog population management, which serves as one of the crucial functions for controlling dog bite cases. And with local bodies implementing the animal birth control program and anti-rabies vaccination, for which the central government has framed Animal Birth Control Rules 2023, and the Animal Welfare Board of India issuing various advisories for the public and local authorities for the management of dogs and responsible pet parentships. And as the debate in the country continues, with heated discussions on the matter earlier this week becoming a part of dinner table conversations, it is also a highly emotional issue, one which continues to get in strong reactions.